Yeah, I want to dive deeper into DocVocate and exactly along one of those lines, which is one of those 15 or more segments of healthcare revenue cycle management. But as a prerequisite for our audience, I'd like to talk a little bit about fee for service, the prevailing business model in the US, and specifically about claims. So, for our audience, what is a claim and why is that important?
Yeah, I mean, honestly, that is the unit of measurement, I think, for our system. So, it's the claim is basically a representation of a specific episode of care, you could say, or a specific event, a healthcare event. So, I go to get knee surgery. There can be more than one claim that comes from that, but let's just say I go to get knee surgery. Then coming out of that knee surgery, a claim is going to be uh, I guess you could say, file that gets sent to the insurance company saying, okay, there's a 99213 code that's associated with the visit. The implant that we put into Haynes's knee, that's a different code, right? The action of clipping his cartilage, that might be a different code. So there's diagnosis codes, but there's all these procedure codes, and all that's kind of shipped off to the insurance company, what we effectively just call a claim. Uh, Within that, also, there's financial terms. There's going to be amount that's billed. Like, hey, I as a knee surgeon, I did all these things on Haynes's knee, and here's the 6 codes that go with it. And with those codes, this is the amount that I'm expecting to get paid per our contract with Aetna or whoever. So that's all carried in that claim, and then it gets, that way. And then, but the claims, it's sort of a bi-directional living thing. It's not like a single thing. It's sort of like I send a claim file, and in a way, the insurance company makes a decision. Okay, of these 6, I'm going to pay these 4. I'm not going to pay this one. I'm going to pay half of this one. And that comes back into a response, which is also kind of part of this claim life cycle. And that gives you a sense. And the reason why it's so important is that's containing all the reasoning and the data and everything around how much something is costing and whether it actually, coverage actually happens or not. So much is controlled by that in terms of not just what the physician is going to get paid and what the payer is paying out, the insurance company, but also ultimately what you and I all owe out of pocket for that procedure is all dictated in this little kind of claims world.